Hello everyone, my name is Dr. Owens.
Dr. Owens, what happens during a spinal injury?
If you're talking about a spinal cord injury, what occurs is these are serious injuries that occur to the spinal cord itself. Now these often occur during auto accidents. The spinal cord is a bundle of nerves that runs down through the spinal canal. And during very severe car accidents, what can happen is that parts of these spinal bones can break, leaving an instability in the bony column that's protecting. Now, instead of protecting it, it's endangering it, and these bones can shift and cut off part of the spine, producing a very severe spinal cord injury, maybe something like paralysis, partial or even full paralysis. So these are something that in very serious accidents we want to make sure that you don't suffer from. Getting your back cracked or a higher force adjustment, and I know a lot of you have fears and concerns about getting cracked, and I just wanted to inform you that doesn't. We can work on the spine without this. I want to show you how it's done in this video. The spine, what can occur in the spine, and when the spine gets injured, is a lot of times the spine will get twisted out of place or jammed in such a way that it loses its normal free movement and it pinches nerves and you get nerve injuries. And it's so tender that a lot of people are really afraid to have the area worked on. Well, we need a low force, very gentle way of adjusting that area and getting it moving, or it's going to develop arthritis. That's why I use the ArthroStem adjusting instrument, which is a very low force adjusting instrument. Now, how we use it, and I'll show you on the spine here, and then in a moment I'll show you a live demonstration. But it does a tapping move. It pushes on the surface 16 times a second. Feels very light. Or if it's someone that has a little more muscle, we can push in a little deeper and actually get in there a little deeper. So it's variable, but very light force. I actually even use this on my own kids, and who are now 7 and 8, and they really like it. So when we come in there, what we will do is contact the area with this two-pronged little adjusting head, and we will just start to tap. And as the taps go in there, we start to work the spine, and we work the spine back into its proper position in whatever areas are involved. And that's the basics of how it works. Now, as we move it and get this function back into the spine, the pressure comes off the nerve, the pain goes away, the patient can heal. So, we're going to bring Morgan over. Morgan, come on over and lay on your stomach. And we'll just go through a little example of what it would be like. So when we're doing a spinal adjustment, we feel where the spine is locked. And when we check Morgan, one of her main spots where she's locked is right here in the dead center. So we would come in, we would find the spot that's locked, and contact that spine, and just do a tapping motion. And just work it there a little bit. And when we recheck, it moves better. When we come out, we can also check the rib cage on both sides, because the ribs go out around on both sides. It can be damaged and have problems as well. But we can just do some gentle tapping in there, because a lot of people will suffer from side pain or flank pain, and it's coming from the rib cage. This handles it very nicely. So we'll just work those rib cages, the ribs that are attached to that about a T10 vertebra, T10 and T9 we were just working on. Now when we work down into the lower back here, Morgan actually has a slight subluxation or bone out of place, irritating a nerve in her sacrum. And so we can just do a tapping motion there to free up that joint. And as we work, we're just working that joint very lightly. And we're able to get in there and work those injuries without causing any kinds of extra pain. So that's how we work on someone with a low force or a no force technique, and we do an awful lot of that. It is a technique I specialize in, and so if you've had fears of chiropractic or coming and getting adjusted because you're afraid of getting cracked, give us a call. Thank you for watching my video. Have a great day.